Good morning, team. I want to discuss a recent change in hospital policy regarding patient visitation hours. Starting next week, visiting hours will be extended to accommodate more family members and friends.
That's great news, Mihira. This will definitely improve patient morale.
Absolutely. We want to create a more welcoming and supportive environment for our patients. However, it's important to maintain a quiet and calm atmosphere in the wards.
How can we ensure that the extended visiting hours don't disrupt patient care?
We'll need to implement strict guidelines for visitors. They should avoid making noise, avoid bringing in outside food, and respect the privacy of other patients. We'll also need to educate visitors about infection control measures, such as hand hygiene.
Mihira, will there be any additional staffing requirements to accommodate the increased number of visitors?
We'll assess our staffing needs and adjust our schedules accordingly. We may need to hire additional staff or reassign existing staff to manage the increased workload. I understand you're concerned about flying with your recent injury, Mihira, especially if you had a ligament tear or fracture. It's important to know what signs mean you should seek help from the flight crew immediately, as getting prompt attention can make a difference. The primary things to watch out for involve a sudden worsening of your main symptoms. If the pain in your mentioned the injured joint from the previous response, e.g. ankle or knee, becomes severe and is not relieved by the pain medication you've been taking, that's a clear signal to alert the flight attendants. Similarly, if you develop a high fever or notice any type of discharge or bleeding from the injury site, those are signs of a potential problem, like an infection, that needs quick assessment. Beyond the injury itself, you should also be vigilant for symptoms related to pressure changes or circulation, which can sometimes be more noticeable during a flight. This includes sudden changes in your hearing, especially if accompanied by pressure that won't clear, or experiencing dizziness or balance problems that weren't present before. Please don't hesitate to reach out to the crew if you experience any of these symptoms. They are trained to contact ground support and medical professionals who can provide guidance on what to do next. Your safety and comfort are the priority.